everyone, I am Umina Zahira. Let's stay with me until the end. Ladies and gentlemen, according to WHO, obesity are defined as abnormal or excessive fat accumulation that present a risk to health. A body mass index BMI over 25 is considered overweight and over 30 is obese. Obesity is one side of double burden of malnutrition, and today more people are obese than underweight in every region except Sub-Saharan Africa and Asia. Obesity is chronic condition. People who have overweight or obesity compared to those with a healthy weight are at increased risk of many serious disease and health conditions. What obesity can do to our health condition? This condition put you at risk of having disease such as heart disease and stroke, high blood pressure, diabetes, gout, and so on. Most people who are obese are having a heart disease. There are many factors that lead to heart disease that actually came from obesity. This situation doesn't mean that people who are underweight will not have a heart disease, but overweight gives more and more impact to our heart condition. After going through a few research, I realized that obesity can affect our health condition in a serious way, especially to our heart condition. And today, I would like to persuade you to have a healthy lifestyle, reduce obesity, and keep the body healthy, free from disease. It is because our heart condition will be damaged by obesity, and we must take a good care of our body, keep them healthy. So, without further ado, let's look at the process how obesity will contribute to heart disease. Obesity can contribute to heart disease, whereas it can change your cholesterol level. Most of us know that obesity can cause a spike in bad cholesterol and triglyceride levels. But did you know it also can lower good high density lipoprotein HDL cholesterol? HDL cholesterol is important for removing bad cholesterol and working to reduce the risk for heart disease. Obesity also can cause your blood pressure to rise. Obese individuals require more blood to supply oxygen and nutrients to their bodies, which cause an increase in blood pressure. Your body will also require more pressure to move this blood around. High blood pressure is also a common cause of heart attack, which are sadly more common for obese individuals. Next, high obesity is a major risk factor for type 2 diabetes. Obese individuals also have a much greater chance of developing diabetes. People affected by obesity are about 10 times more likely to have high blood sugar. According to the American Heart Association, at least 68% of people aged 65 or older with diabetes also have heart disease. If you have obesity, several treatment options are available to you to help you to reduce your risk of developing type 2 diabetes. So what's the solution? There are some steps you can take to lose weight, get healthy, and reduce your risk of developing heart disease. The first thing any obese individual, especially those with a family history of cardiovascular disease, should do to get healthy is exercise regularly and eat a nutritionist balanced diet. Talk with your doctor about creating a diet and exercise plan that works best for you based on your current goals and health status. Regular daily physical activity can lower the risk of heart disease. Physical activity helps control your weight. It also reduces the chances of developing other conditions that may put a strain on the heart, such as high blood pressure, high cholesterol, and type 2 diabetes. In general, you should aim for at least 150 minutes a week of moderate aerobic exercise like brisk walking. If you haven't been active in a while, you may need to slowly work up to this goal. Even shorter bursts of exercise are good for the heart, so keep going even if you can't achieve the guidelines. However, you don't need to work out hard to enjoy the benefits. Increase the duration, frequency, and intensity of your exercise will allow you to benefit greater. There are other things that you can do to prevent heart disease other than exercise. Heart disease can reduce other than exercise. Eat a heart-healthy diet is one of the solutions. A heart-healthy eating plans include vegetable and fruit, beans or legumes, lean meats and fish, low-fat or fat-free dairy food, whole grain, and many more. You also advise to make a limit intake of salt, sugar, processed carbohydrates, and alcohol. Other thing you can do is get a good quality of sleep. Get a good quality sleep also can prevent a heart disease. People who don't get enough sleep have a higher risk of obesity, high blood pressure, heart attack, diabetes, and depression. Most adults need at least 7 hours of sleep each night. Make sleep a priority in your life. If you feel like you've been getting enough sleep but you are still tired throughout the day, ask your healthcare provider if you need to be evaluated for obstructive sleep apnea. Sleep apnea is a condition that can increase your risk of heart disease. Treatment for obstructive sleep apnea may include losing weight if you are overweight or using a continuous positive airway pressure CPAP device that keeps your airway open while you sleep. To conclude, obesity may increase your risk of developing heart disease, but you can take a variety of steps to reduce your risk to enhance your general health. Even 5% to 10% of your body weight loss can have a significant impact. Your chance of developing heart disease can be decreased with a minor lifestyle adjustment like increasing your exercise and eating healthier. Other options to support you in leading a full, active life include medication and surgery. Your healthcare professional can assist you in developing a realistic plan to enhance your health. And last but not least, take a good care of your body and make it healthier for you to enjoy your life journey better.